Thank you very much and good afternoon. Today, on December 3rd, we have an additional 694 people who are positive or who have been diagnosed with COVID-19 here in British Columbia, including 4 who are epidemiologically linked cases, bringing the number of people with COVID-19 in BC to 35,422 people. Of the new cases, 114 people are in the Vancouver Coastal Health Region, 465 people are in the Fraser Health Region, 10 people are on Vancouver Island Health, 82 people are in Interior Health Region, and 23 people are in the Northern Health Region. We are now up to 9,103 active cases across the province in all health authorities, of whom 325 are in hospital currently, 80 of whom are in critical care or ICU. We have 10,849 people under active public health monitoring and 24,928 people who are recovered from COVID-19. Again, today we have 12 new deaths to report, to bring our total number of people who have died from COVID-19 to 481 in the province. And my heartfelt condolences go out again to the families, our care providers, and the communities who lost loved ones, and we mourn with you. We have 3 new healthcare outbreaks to report in British Columbia, one at the Bailey House long-term care home, one at Gateway Lodge, and the University Hospital of Northern BC, both of which are in the Northern Health Authority. We now have 56 active outbreaks in long-term care and assisted living, and 8 in acute care. And that involves 958 residents and 559 staff across the province. We are continuing to make progress, as we talked about earlier this week, on our BC COVID-19 immunization vaccine strategy. Operation Immunize, and we have established now our emergency response or emergency operations coordinating committee to lead the management and very soon, we hope, delivery of vaccines across our province. And today, Dr. Ross Brown, who has been leading the charge on this, along with a number of our key folk from the BC CDC team and others, participated with our provincial and federal counterparts on a remote tabletop exercise to try and walk through all of those key steps that we're going to need to have in place and understand how to facilitate the vaccine delivery and then immunization processes here in the province, and to anticipate any of the challenges or roadblocks that might come up so we can address them now, as we know that vaccine will be available in the coming weeks. And next week, Dr. Brown and myself and Minister Dix will provide a detailed update to everybody on our plans and where we are and how we are going to move forward here in British Columbia to make sure that people can receive immunization in the most efficient and effective way possible as soon as it is available here in Canada. As you know, our focus with this pandemic has been to understand risks and to take the measures we need to address those risks. And the risks are about where and how and with whom transmission is occurring. And that is what we have been doing, and we've been learning from the very beginning. We look at what is happening here in BC, as well as we look at what happens across Canada, across the US, and around the world, and we learn from what is happening and the measures that people are taking everywhere. And based on this information, we put in the measures that we feel are needed here in British Columbia to best protect everyone in the province. As vaccines become available, they will become our first step to protect people who are most at risk from severe illness and from death, and to protect our healthcare system. We know that we will have limited amounts at first, so we won't be able to broadly achieve what we've been calling community immunity or herd immunity right off the bat, but that will come. Our first priority will be to make sure that we're protecting those who are most at risk. We know that is our seniors and elders in our communities, in long-term care homes in particular, and in hospitals here in British Columbia. And once we have more vaccine available, we will be making it available to all of us in BC. And that is when we can get to that point of managing and controlling this pandemic. But for now, we must all stay strong. Many of our communities around this province are affected right now, many of whom went through the first wave, the first number of months of this pandemic without having cases, without having it touch close to home. And we know that our long-term care homes in particular are most vulnerable, and we know right now it's the biggest challenge that we are facing. And the healthcare workers who are working tirelessly in our hospitals, but in our care homes across the province, are doing their very best to care for people on a daily basis and to try and keep this virus at bay. But we know our hospitals, our long-term care homes, and our healthcare workers are strained and are tired. And we need to do our bit everywhere to make sure that we support and protect them too. And that is the purpose of the orders that we've had in place here in BC, the reason why we need to reduce our social interactions, the reason why we have postponed or suspended or cancelled events, the reason why we put in restrictions on some of the adult team sports that we have had and been able to enjoy in the last little while. What we have seen is that when people come together, this virus can spread, now more than ever, particularly as we go through winter in the province. I do want to say, though, that I recognize that this sacrifice is one that all of us are taking, and the vast majority of people around BC have taken this to heart and are doing their part to protect us all, to protect those we are closest to and those we don't know. And you may feel that you are the only one. It seems like there's lots out there of people who are not taking this seriously. But I know better. I know that we have seen sacrifices from people everywhere in BC, and that you are all part of our team, and that is what is making the difference for us. We need to stay all in, 100% committed to getting us through these next few weeks to months, so that we will have the ability to protect people and to save lives. And through your efforts, we will get through this. We will get through this pandemic together, and we will do it by being kind and being calm and being safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to join Dr. Henry, and I know on behalf of the Premier and all people in BC in passing on condolences to the families, the friends, the caregivers of the 12 people who passed away, 8 in the Fraser Health Authority, 4 in the Vancouver Coastal Health Authority in the last 24 hours. This is, and some of these, of course, a significant proportion, as has been consistent throughout the pandemic, are occurring in long-term care, and we want to pass on our special wishes because we know how difficult a time this is for whole communities of people in long-term care, for everybody who's dealing with an outbreak anywhere in British Columbia in a long-term care home, whether they're residents themselves or families of residents or caregivers, that is a moment of extraordinary stress. And to combine with that the sense of loss and what it means to people, we want to say to people that we're with them, that we're thinking of them, and that every single case matters to us, and I know matters to people across the province. And so any day when you're reporting any death is a difficult day, and today we're reporting 12, and that tells you how difficult a day it is. Wanted to note we have 325 people in hospital, and that's 80 of those in critical care, I believe, 9,103 active cases, 10,843 people under public health surveillance. And what that tells us is how hard people are working in public health. And I want to put this in context with the information about the surgical renewal commitment that's going on during this pandemic in British Columbia. And I just thought I'd start by noting, and you'll know that since May 18th, since we relaunched non-urgent scheduled, or sometimes called elective surgeries in BC, 49,100 have been completed in Fraser Health, 32,919 in Interior Health, 10,458 in Northern Health, 42,516 in Vancouver Coastal Health, a remarkable 37,543 in Vancouver Island Health, and 7,266 in the Provincial Health Services Authority. Last week, health authorities reported 6,691 surgeries completed from November 16th to November 22nd. They've now verified their data and the total number of surgeries completed during that week. And you all recall the challenges of the week of November 16th to 22nd. The total number of surgeries was in fact 7,152, which was 130 more surgeries in this case than the precise number that took place the year previous. And this is in spite of the fact, this week I should add, from November 23rd to 29th, the preliminary number is 6,736 surgeries, although we would expect that number to rise in a similar way when the full accounting is done. This occurred, of course, during a week where we're reporting that at Lions Gate Hospital, a total of 25 cases were postponed due to the COVID-19 outbreak at that facility. Urgent and emergency surgeries continue at Lions Gate, as well as surgeries that don't require an overnight stay. And obviously, there's been a profound impact, not just by the outbreak, but by the fire at Burnaby Hospital. This week, the surgeries performed at the site decreased by approximately 120 surgeries. But across the system, by the time we gather all the information about this immediate week that we've been in, we'll have done more surgeries this week. By we, I mean the surgeons and the nurses and the healthcare workers and the administration staff that supports it and the health sciences professionals than the same period last year, which gives you a sense of what healthcare workers are doing in addition to dealing with COVID-19 in a week, of course. And in a day, we're reporting 325 COVID-19 patients in a hospital, and it goes without saying that is 325 more than last year. I want to note in terms of our capacity, because there's been some questions about acute care capacity in recent days, in terms of our base bed capacity, it's 87.8% of our base beds and 70.6% of our base and surge beds in BC. That's the level of beds that are occupied overall in hospitals. Just to put that in context, last year at this time it was 103.5% of base bed capacity, and that our critical care capacity is running at 76% of our base critical care capacity, but of course we've added critical care capacity and that number is 54.6%. That doesn't mean it's easy and in every case. And what you've heard and what you'll continue to hear is where appropriate, patients are occasionally moved, sometimes from the north to either Vancouver Island or to Metro Vancouver hospitals. That is something that happens all the time in healthcare for a couple of reasons. One, it's very important in some of our regional hospitals, such as Mills Memorial and so on, that we ensure there's adequate ICU capacity in case of other circumstances that occur. For example, potentially, especially this time of year, a major accident on a highway. So at times we move people around, and sometimes because hospitals in Metro Vancouver can provide better treatment for a particular patient. That, what you're seeing, is the public healthcare system working as it should in a pandemic, and working as it should every day. But that said, it's very challenging times. It is very challenging times. It has implications, and especially the main implications are for staffing at a time when, of course, a very significant number of healthcare workers themselves have tested positive for COVID-19 in both long-term care and acute care. So our stress is that, the stress on our healthcare workers. It's not about bed capacity, but it is about the extraordinary work done by people in our public healthcare system and by the workers in our public healthcare system. And I want to salute them today, especially on a day when we announce this many new surgeries done in spite of the pandemic. And I just want to say finally, we're entering into this Christmas period. And it is, of course, an important time of year for everybody. It's an important time for all communities. We're also entering into the period of Hanukkah and other holidays and the New Year's and all of the things that happen. And this year, it's simply going to have to be different. And the reason why we need to take action together, in part, is to protect those very healthcare workers who are protecting us. Sometimes that means we've had to cancel events. In fact, we're having to cancel all the events right now. And part of the reason to do that is we don't have to cancel surgeries, and that we can provide better protection for people in long-term care. And I think that empowers all of us to be part of our ongoing effort. I so appreciate what people have done since January. We've been involved in this. We've been briefing on this since January. It's been part of our lives here in British Columbia since then in a profound way. And I so appreciate that today, on December 3rd, that people are still contributing, still making a difference in every community of the province. And we simply have to keep going now. This is the time we have to dig in and follow the health orders, to be 100% all in support of what Dr. Henry and public health is asking us to do, and in some cases by orders telling us to do. We need to do that for the ones that we care for, the ones that we love, and for the ones we don't know. And as we move forward into another COVID weekend, which with Friday, Saturday, Sunday ahead of us, I think this weekend is especially one where we have to follow those orders. On Monday, Dr. Henry, based on evidence and based on reflection, will be saying what will happen to orders. And at that time, she'll be commenting on that. But in the meantime, it's time to dig in, like I say, and continue to do what British Columbians, I think, have done since the beginning of the pandemic, which is to care for one another, look out for one another, and fight for one another. Aujourd'hui, il y avait dans la province de la Colombie-Britannique 600... on a les noms des chiffres, excusez-moi. Exactement 694 nouveaux cas de COVID-19 dans la province. Il y a 35 422 cas dans la province de la Colombie-Britannique. Il y a à l'hôpital, le niveau d'hospitalisation, c'est 325. Il y a bien entendu 903 cas actifs dans la province. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please unmute your phones. You are not audible until I call your name. First question today is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. My question is about your new order shutting down adult sports. They're suspended now, everything from hockey to soccer, even bowling. But anyone under 18 can still practice and train with their teams. Even dance studios are now allowed to open their children's programs. So my question is, why the big difference between what's allowed for kids and even teenagers and what's allowed for adults?
Yeah, this was, as I've mentioned, we have a team that have been looking at all of the different fitness sport activities and trying to come up with our best guidance. And what we have found, and I mentioned this a bit yesterday, is that a number of these adult team sports are really very much social gatherings as well as sport. And unfortunately, those types of gatherings are leading to transmission events that are happening. And I mentioned hockey yesterday. We've seen transmission events in curling. We've seen it with a number of adult team sports. So now's our time. We need to step back from those, take that temptation, unfortunately, away, and make sure that we're not giving those opportunities for the virus to take hold and travel and go between different communities, as we have seen happen in the last few weeks, unfortunately. So it was the advice of the team from around the province that this was an important thing that they felt we needed to do now. So that is an additional restriction. On the other hand, we know that the supervised sports for young people have not been a source of the same type of risk and transmission. So we are And we recognize, of course, the importance for young people of having these opportunities to participate in sport and how important it is. And again, these are things that we learned from the unintended consequences of what happened in March and April last year. So we are hoping that we can preserve safely those opportunities for young people without the riskier parts of what they've been doing around playing games and travel. And so again, it will be focusing on skills and drills and keeping safe distances, but allowing those opportunities for kids to get out and participate. I will say I recognize absolutely how important it is for adults as well, and I encourage everybody to go out with one or two of your friends, go for a run, go for a walk. There are those sports like tennis, like swimming, like golf, where people can still participate and maintain their safe distances. I've said this many, many times, it's the locker room, it's the before, it's the after, it's the going for a coffee or a beer after a game that has been the most source of transmission, but sometimes it's very difficult because much of that is built into the culture of many of the adult team sports. So let's focus on our children. Let's focus on giving those safe opportunities for young people to stay active for those sports that they can do right now. And these are really, I think, I don't want to take away from the importance of things like music and art and all of the other things that are important for young people and for all of us in getting through times like this. But it is those art and theater and music that we can do safely remotely, and we can do group classes remotely as well. I look at the gym that I belong to, and we do a Zoom circuit class on Saturday mornings. So there are great opportunities that we can come together and have opportunities for fitness in our lives. And we're trying to find that balance of making sure we have those important opportunities, particularly to protect those opportunities for young people.
Shannon, do you have a follow-up?
Yeah, a question on behalf of a colleague for Dr. Henry. The U.S. CDC has adjusted its recommendations for the length of quarantine after possible exposure from 14 days to 10 with no test or symptoms, or 7 with a negative result. We've also heard early data shows the Calgary International Arrivals Pilot Project has a positivity rate that's quite low. So in your view, what hope is there based on the science and data that we could be making adjustments in how we handle quarantine and isolation periods as we move into the vaccine stage?
Yeah, so I have watched that, and we have had talks nationally about this, and that is for travel-related quarantines from people come into the country, and yes, there is a case to be made, particularly for 10 days. The chances of somebody, depending on what the type of exposure is that they had, so somebody traveling from a country with COVID, so somebody coming in from potentially from the U.S., there's very few people that show symptoms between day 10 and day 14 who have not shown symptoms prior to that. And if you have a negative test around day 7, then your chances of having symptoms in the second couple of days or the second week of the incubation period go down even more. But this is only for people who are traveling at the moment. The types of exposures that are included in that are very low risk exposures. So this would not be appropriate, for example, in a healthcare facility outbreak or a family transmission event. So we are looking at that, and we're having discussions nationally. I think it is a way to try and make things flow more smoothly once we start to travel again. I want to say that right now we are not recommending that people travel. As a matter of fact, we're recommending people don't travel outside your community. It's time to stay local here in BC and in Canada, and my counterparts across the country are giving that same message. But these are strategies that we are certainly looking at nationally.
Next question is from Richard Zussman, Global News.
I'd like to ask Dr. Henry about what Shannon asked at the beginning there. Yesterday you mentioned that there was going to be restriction on indoor sports, and then we found out it was outdoor sports, but didn't see the order until today. Can you talk about why there are these delays to actually having the information in front of you? And are you concerned about the sort of confusion that causes with people as they hear something and then need to wait for specific details?
Yeah, it is what it is. I believe I said yesterday, and sometimes perhaps I don't say it quite the way I meant to, but I was talking about adult team sports. And I didn't recall making a distinction between indoor and outdoor. What we're talking about is adult team sports. Right now, this time of year, of course, most of those are hockey, curling, etc. But there is still some soccer and other team sports that are going on. So that was the intent. And the order was written prior to my coming down here, but it is a challenge because all of the orders do come into effect. We have the ability to give an order verbally, and I try to be very precise in the language I use. When that goes back, and we do it at the same time, and we try and have it ready ahead of time, the papering of the order, as it were, but it needs to go through legal review, and sometimes in changing the legal language, some of the nuance gets lost or changed. So I think I just ask people to bear with me and to understand the intent of the orders, and that's what we're talking about. The intent of the orders is to try and reduce opportunities for this virus to spread, and in those areas where we have seen that are higher risk right now. And that changes and it varies over time, and we come to understand as we're progressing through this pandemic what are those situations. So yes, I know for some people it is also challenging because they want to make sure it actually applies to them. And I know these are difficult things to have, especially if you're a business owner who runs a spin studio. You know, you need to really, even if you've done everything right, we know that that is a high intensity activity indoors and generally with loud music and crowded together. And that just cannot happen right now because of the risk of the virus transmission. So there needs to be other models that you can go to. And I know it's very challenging for people to accept that sometimes, and we try and be as precise as possible.
Do you have a follow-up, Richard?
With these changes happening so quickly, you know, there's a lot of disappointed people. I know everybody is doing their best to follow the rules and the guidance. And, you know, one of those things is the cancellation of games. As you know, people would have had, you know, kids, let's talk youth, because they can still practice. They would have had games last night. They would have games tonight. And they may have got home from school and their parents say, well, your game's off tonight. You know, what do you say to those kids about the cancellation of these games that they have been looking forward to and training for and getting ready for? And how have we seen transmission specifically related to kids playing the actual games?
Yeah, so my appeal to young people, and I know that things that you look forward to have been so adversely affected by this pandemic, and no more than young people have really taken the brunt of some of these changes. And I know that is hard. But I also know that you guys are adaptable and you're superheroes in my mind. And I know that you can make this work. And being able to get out there and have those opportunities to be with your friends, to keep your distances, to keep things safe for this period of time. And it may feel like it, but it is not forever. It will change. We will get back to having games. And it will get back to being able to move around and travel and play against people in other communities too. But right now, we're still having challenges. And it's not so much the kids out on the field, it's the away from fields of play. And we tried to look at not having travel, no spectators, to try and reduce those probabilities. But we're finding that it's still a challenge. And in discussions with many of the leagues, that was when we recognized that it made it a lot simpler for them to have very clear restrictions and the guidelines that have come out from Via Sport. We were looking at modifying them to find some ways of having limited games in local areas, but it became very complex. So to simplify things, particularly now, because we are seeing raising numbers of cases in communities around this province and across this country, and now's the time where we need to just take a step back from that. And I know that many of the leagues, the hockey leagues and soccer leagues and other youth leagues have already done this, so it makes it very clear and equal for everybody.
Next question is from Jane Side, North Shore News.
Hi, Dr. Henry. I have the first question on a similar topic, I guess, of the youth and recreation activities. I'm wondering if you can tell us, like roughly what percentage of the cases we're seeing are being spread by sports and recreation, and sort of where and how is this happening? For instance, we've heard about tennis facilities that were the cause of some cases, and that doesn't really feel like it would be an especially high-risk activity, even though it's indoors, and things like, you know, Tai Chi. What has your team actually discovered? Is it like a certain number of people? Is it a certain level of breathing or aerosol transmission? Is it the carpooling? I know you've talked a little bit about it, but it still seems to be something that's a bit confusing, and I'm wondering what information you have for us.
Yeah, so I would say it's all of the above, and it's really difficult when people want to parse out exactly why can I do this and I can't do that, and want to make analogies that, well, you know, it didn't happen to me in my club, so it should be okay. But the reality is it varies over time, and it varies depending on what activities we're seeing happen. But there are some things that are common. So what we have seen in the past few weeks to months is that about 10 to 15% of cases have been related to physical fitness and sport activities. And that's an underestimate. Those are the ones that we know that we have linked. And, you know, I presented some of the pathways that we have seen happen. So what we do know is that those high intensity, and this is what the team, our sports team, has been working on, looking at high intensity activities indoors. And some of those are, we know there's been transmission in more than one occasion to numbers of people in the dozens, and then subsequent transmission on from that is the spin classes, the high intensity interval training, and hot yoga. And if you think about it, these are areas where you have groups of people that are close together, very high breathing, high intensity, or lack of ventilation, which by nature hot yoga is. So it is those ones where we have seen most intense. The other one that comes to mind is Zumba in an indoor class. So those are where we are seeing very intense transmission, and that's just very risky right now. They were fine in the summer with certain precautions in place, but what we thought were safe guidelines we've seen, and not just here, we've seen this around the world, don't work right now. So those ones are off the table for a while. Then what we were seeing is some of these lower intensity, the types of measures that we had in place for, you know, regular dance class, martial arts classes, and others. If you had too many people and they were too close together, even those lower intensity ones led to transmission events. So what the guidelines are being revised based on the evidence that we've been trying to find from around the world to make sure that new guidelines can allow those to happen with smaller numbers, greater space between people through this period of time and still be safe. And then we look at the team sports, and we've been working very closely, as I said, with Via Sport and others around different team activities and sports activities. And the one-on-one sports activities, one-on-one fitness training in a gym when you're by yourself or with a trainer, and all the appropriate safety measures in place, those seem to be lower risk and seem to be okay. But we are seeing that team sports for adults in particular are ones where it's the before play or away from the field of play interactions that we're seeing most of the transmission. And Tennis is a good example where we've had quite large clusters related to a tennis club, not the activity itself, but the ancillary activities around playing tennis, for example. So it varies a little bit, but all of these right now have one thing in common, and it's those coming together, sometimes indoors, but those social interactions that we have when we're too close to people right now, and there's that level of circulating virus in our community that is much higher than it was even a few weeks ago. So that is why we've put in these restrictions now, and they will last through the next few weeks.
Jane, do you have a follow-up?
I do have another question. This is about the North Shore Lionsgate Hospital. Minister Dix mentioned Lionsgate when talking about the surgeries. I'm just wondering if either of you can give an update on the situation there. It's one of the acute care outbreaks. I'm wondering if you can update in terms of how many people, how many patients have contracted COVID while at the hospital for something else, how many staff have contracted it, and just generally what the situation is with the outbreak at Lionsgate Hospital.
I know that Vancouver Coastal has been working with the team at the hospital, and I don't have the updated numbers with me right now, but we can get you that. And there was an additional death from Lionsgate Hospital today. One of the people who died was involved in that outbreak, but I know the investigation and the control measures are in place there now.
Next question is from Mary Griffin, Check News.
Oh, hi. Thank you so much for taking my question, Dr. Henry. We're hearing that the outbreak at Saanich Peninsula Hospital is much worse than previously thought. I'm just wondering if you could expand on any of the information on that, and just wondering if there's a lock yet on how the virus started and the potential in a setting such as a hospital for how widespread it could be.
Yeah, so again, Island Health is leading the investigation with the team at Saanich Peninsula Hospital, and they're using all the experience that we have shared with each other from hospital outbreaks in other places. And there are additional cases that were identified in both staff and patients today. And I know Island Health is putting out an update about that. It is still confined as far as we're aware, and they're doing additional testing of anybody who was in that area. So the hospital remains closed to admissions, but it is not affecting the emergency department, the radiology department, and those are still open and safe for people to access. So part of the outbreak management is making sure we can cohort and make sure people aren't working back and forth in places where there have been cases and where there haven't. So they have put in measures to make sure that the critical functions, particularly the emergency department, are protected. And the investigation is ongoing. Usually in the first few days is when we start to get a sense of how widespread it might be. So there's cleaning and additional measures put in place around making sure we're tracing all of the healthcare workers and the patients and who was where, and also testing of everybody in the affected area. So that is ongoing, and that will give us a better idea in the next few days just how widespread it is.
Mary, do you have a follow-up?
I do. Thanks, Lindsay. Just in terms of the vaccine rollout, you are giving a bit of a timeline as to when the first immunizations may occur. But I'm just wondering, for the general population, we've heard that across Canada it could be as long as a year. Do you think that's a reasonable timeline for most people to expect when they may be vaccinated who are not fitting into any of those high-risk areas?
Yeah, so we are planning to be able to put vaccine into arms. The first week of January is what we're planning for, to make sure we are absolutely ready by then at the very least. We know that we expect that we'll have 2 vaccines to start with. The Pfizer vaccine, which is approved for use, I mentioned yesterday, in the UK and is under review right now by Health Canada for what we call a notice of compliance, which is a license for its use here in Canada. And so as soon as that product is available and licensed, we will be ready to immunize people. The second vaccine that is in the pipeline for a notice of compliance in Canada is the Moderna vaccine, and Canada is expecting to receive that as well. And again, we're looking at the first week of January to be ready for that vaccine for both products. But they're likely to be the only ones that we'll have early on in 2021. And we have about 6 million doses across the country of that vaccine that we expect to come through the weeks of January, February, March. So that's not enough for everybody. What we do know, though, there are at least 2 other products that have submitted or are in the process of submitting data to Health Canada and to regulatory agencies around the world, the AstraZeneca vaccine and the Janssen vaccine. So those ones, we hope, will be available and ready in the province sometime around second quarter of 2021. And by the time we get into April of 2021, we're expecting increased numbers of all of the vaccines to be available. And that's when we can start offering it to more people across British Columbia and across Canada. But it will take some time, and we need to sort of sequence it in as we go, because we can't do everybody at once. But as long as the vaccine continues to come in, as long as the safety and the effectiveness is good, we expect, and what we're planning for, all of our planning constructs is to be ready to start the first week of January and to hope to have everybody done by September of next year. So we expect there'll be a good lot of people who will be immunized by the summer and through the fall next year. But by the end of the year, anybody who wants vaccine in BC and in Canada should have it available to them and should be immunized.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Tina Lovegreen, CBC.
Thank you so much. My question is for Minister Dix. Do you have an update on the review of spending at PHSA that you ordered late last week?
Yes, I do, and I apologize. I think yesterday I said we'd be releasing it today. We'll be releasing it tomorrow morning. I received the report and recommendations from Deputy Minister Stephen Brown on Tuesday. It's Thursday today, so it was 2 days ago. And we would have released today. It's entirely my responsibility. It's been a day of regular meetings around COVID-19, but we're ready to go, and we'll release it to you tomorrow morning. You'll have all the information you need.
Tina, do you have a follow-up?
Yes, please. Dr. Henry, I'm wondering, how worried are you about the current increase in cases in smaller communities around the province, particularly in the north, and their ability to respond to a large number of cases? Would you consider adjusting the case threshold needed in smaller communities before the public is notified of an outbreak? And if we could please get an answer on this topic in French as well.
Yeah, so we are watching this very carefully, and we meet regularly with the public health team around the province and with the hospital and acute care operations teams to make sure we have that balance. And yes, our teams are strained. The follow-up of people in smaller communities, the investigation of who gave what to whom, just community transmission in and of itself is not an outbreak. We do have outbreaks we've had a couple related to large industrial places, related to sports, as we've known, and related to a couple of long-term care homes, hospitals, workplaces. But it is the spread in communities related to our social interactions and travel that is really what is spreading across the north and in much of the interior and here on the island. So those are the things that we all can control. And yes, I am concerned. I'm concerned because I know our public health teams are working flat out 24 hours a day, 7 days a week, and it is hard. and it's hard work, and people are in, it's an anxiety-provoking time, and people are rightly concerned. So we all have to do our part, and we can do that by reducing our social interactions, keeping our safe distance, wearing our mask when we're in outdoor and public places, indoor public places, staying away from others if we're not feeling well, and staying home and not traveling. And that's what's incredibly important for all of us right now. The orders and the measures that we have in place are to address the fact that this is spreading from people, and we spread it to those people we are closest to, the people that we're in houses with, the people that we live with, the people we visit, the people we work with when we're close together and not having our layers of protection in place.
And just to add in English that the Premier announced the Rural, Remote and Indigenous Plan on April the 20th, and that has been implemented across the board. You see a dramatic and significant increase. I think it's more than 60 ambulances, 6 fixed wing or helicopter additions to our force, which increase our capacity to move people around and get them closer to care in remote communities. That includes also significant advancements in virtual care, and a lot of that has been in consultation with the First Nations Health Authority. But there is no question that in communities that have smaller hospitals and have significant outbreaks, that puts pressure on, and that's why such measures have been put in place. But I think everywhere in the province, our teams are working flat out, and we appreciate their efforts. And there's an especial challenge in the north because of the distance between communities sometimes in engaging in the kind of supports and contact tracing we need, and that's why those changes and those things were put into place. Je veux dire en français que surtout au nord, mais partout dans la province, nos équipes travaillent à fond actuellement, c'est-à-dire que surtout, par exemple, actuellement à Kitimat et à Terrace, où il y a des effets évidents de la pandémie dans ces communautés-là. Cela met de la pression sur l'hôpital à Kitimat, l'hôpital Mills Memorial à Terrace. Et donc, ce qui est nécessaire actuellement, c'est de suivre les ordres de Dr. Henry partout dans la province, et surtout de ne voyager pas du tout, sauf quand c'est nécessaire. C'est absolument essentiel en ce moment dans toutes les régions de la Colombie-Britannique, dans la région de santé du Nord, bien entendu, mais aussi la région de santé de l'intérieur, où on voit beaucoup de cas plus que 80 aujourd'hui, et où c'est nécessaire, surtout les gens qui voyagent entre l'Alberta et la Colombie-Britannique. Si c'est essentiel, il faut que tout le monde prenne soin. Et si ce n'est pas essentiel, ne voyage pas. Merci beaucoup. Thank you very much. And we'll see you on Monday.